My name is Ambrielle. In this video, I'll be demonstrating glucose measuring and mixing and administering insulin. First, I'm going to start by verifying my physician's orders and identifying my patient. Performing hand hygiene, donning clean gloves. To verify my patient, I'm going to have them to state their name and date of birth and compare it with their armband. I'm going to have my client to wash and dry their hands. I'm going to turn on the glucometer and insert a test strip. I'm going to select the distal end lateral side of the finger and wipe it with an antiseptic wipe. I'm going to pierce the lateral side of the finger with a lancet and wipe the first blood with a cotton swab. I'm then going to gently squeeze the finger, place the glucometer at the tip of the finger, and allow the blood to weaken to the test strip. The patient's results should display on the screen. At this time, the patient's blood glucose is 252. I would then turn off the glucometer, disinfect it. I will explain the results to the client, remove my gloves, perform hand hygiene, and document. Prior to mixing and administering insulin, I need to be aware of the 6 rights of medication administration. You need to have the right route, the right dose, the right medication, right patient, right time, and the right documentation. Insulin can be administered via insulin pen, subcutaneous, insulin pump, or insulin injection. At this time, I'll be demonstrating mixing and administering insulin. So of course, I'm going to verify my physician's orders, identify my patient, perform hand hygiene, and don clean gloves. I'm going to compare my orders with the MAR. I'm going to perform a focused assessment, noting signs and symptoms of hyperglycemia. Signs and symptoms of hyperglycemia are polyuria, polydipsia, polyphagia. Signs and symptoms of hypoglycemia: diaphoresis, clammy skin, a feeling of being jittery, or confusion. I'm also going to assess the integrity of the skin. I'm going to assess the last administration site. I'm then going to compare the insulin that I have pulled with the MAR. I'm going to check the expiration date and roll the vials in my hand. According to the physician's order, the client is going to be receiving 16 units of NPH and 6 units of regular insulin. First, I'm going to wipe the vials with an alcohol swab. Then I will draw up 16 units of air. To inject into the NPH, being sure not to touch the needle to the insulin. Then I would withdraw the needle and inject 6 units of air into the regular insulin. Keeping the needle in place, I would immediately withdraw 6 units of insulin. Then remove the needle and inject the needle into the NPH and withdraw 16 units of NPH for a total of 22 units. Making sure there's no air bubbles. Then I will scoop the lid back onto the syringe. And if I was mixing this outside of the room, I would label it with the client's name. But at this time, I'm at the bedside. I would then have a second nurse to verify my insulin. I'll perform the third check at the bedside. I would remove my gloves and perform hand hygiene. I would explain the procedure to the patient and don clean gloves. Administering insulin, the sites that you can administer insulin, you can do the abdomen, the backs of the arms, or the thighs. We're going to be demonstrating using our orange here. First, you will wipe the skin with an alcohol swab in a circular motion and allow it to dry. You would then pinch the skin. If you could pinch 1 inch of skin, you would inject at a 45-degree angle. If you can pinch 2 inches of skin, you would inject at a 90-degree angle. We're going to pinch 1 inch and inject at a 45-degree angle. So you pinch the skin, inject the insulin needle at a 45-degree angle, and administer the insulin. You would withdraw the needle, initiate your safety feature, discard the needle into the sharps, gently place the alcohol pad on top of the skin. I would then remove my gloves, perform hand hygiene, and document the procedure, document the patient's response. Thank you.